Well, hello, and thank you for joining me today for episode number 15 of the Healthy Skeptic MD podcast. I'm Dr. Michael Hochman. After today's episode, I'm going to do one more episode before the holidays, then I'm going to take a couple weeks off. And after that, I'm going to start a new season of the Healthy Skeptic MD podcast, and I'm going to focus more on specific day-to-day health issues that we all need to decide on. So, for example, I'll do an episode focusing on should we take a daily multivitamin? What are the pros and cons of that? What about a daily glass of wine? And I'll interview an expert who can give some insights on that issues. Is that overall good for our health? Also, should I be screened for prostate cancer? We got a little bit of a hint on that from our previous episode with Dr. Gil Welch earlier in this season. So we'll have a chance to really delve into some of these more day-to-day important key health decisions that we all need to make. So very much looking forward to that in the new year, and just wanted to give you all a heads up on that new season that's coming up. So for today's episode, I am very happy and honored to be joined by the one and only Dr. Jessica Hochman, who also happens to be my wife. In my unbiased opinion, she is a world-renowned pediatrician, and she's going to give us some insights on how COVID-19 presents in children, a little bit about the pros and cons of opening schools up again, and also some just general COVID pediatric type questions. So look forward to having her join shortly. Okay, so before we jump into our interview today with Jessica, let's do a quick rundown, as always, of the health news of the week. So by the time today's episode airs, it is most likely that the FDA will have already provided an emergency use authorization for the Pfizer COVID-19 vaccine. This will allow the drug maker to start distributing the vaccine to healthcare workers, which many health systems around the country are frantically preparing to do to get those frontline healthcare workers vaccinated. So in preparation for this FDA meeting, we got our first look at the actual data from the Pfizer trial, and I have had a chance to delve into it. And my insights are as follows. First, clearly this is a very, very effective vaccine. If you compare people who got the vaccine with placebos, rates of COVID-19 infection were much, much higher in the placebo group. In other words, the vaccine really does seem to prevent the disease, which is great news, obviously. The other really good news is there were no signs of any severe, and by severe I mean life-threatening adverse effects from this vaccine. Again, great news. What did catch my attention, though, is that there were a high rate of what I would call mild side effects of the vaccine. So about 3/4 of participants had a local injection site reaction, so some swelling and inflammation and pain where the vaccine was given. About 16% of participants who got the vaccine had actually a fever within the first couple of days of receiving the second dose of the vaccine. So it seems that the adverse effects were worse in the second vaccine dose rather than the first vaccine. It's a 2-dose series. About 60% of people experienced fatigue within a couple days of receiving the second dose. 52% had headaches, 37% had muscle pains, 22% had joint pain. So some vaccines, they're very, very well tolerated, but other vaccines, for example, those of you who might have gotten the shingles vaccine will notice that there are some of those annoying side effects. And unfortunately, this is one of those vaccines that clearly is going to have some of those annoying side effects. So I think that's something that we all just need to be prepared for. But clearly the good news is that overall it's very effective and there are no major serious life-threatening type adverse effects that were apparent in the data so far. So the second item I want to talk to before we jump into the interview is the surging rates of COVID-19. Clearly, rates of infections are rising right now. I'm working right now at LA County USC Medical Center, which is the main public hospital here in Los Angeles, or certainly the biggest one. We have more than 100 patients with COVID-19. Although things are under control now, myself and many others are worried about whether there's going to be enough doctors and nurses and hospital capacity to take care of all these patients. So the question is, what can we do from a public health measure to control rates until that vaccine gets out there so we don't overwhelm our medical professionals and hospitals? So here in California, our governor recently issued a safer at home order, which will really cause many businesses to close down. We'll encourage almost everybody to stay inside the majority of the time. And what I'm concerned about here, and is already seeing happening, is a backlash. Many are ignoring the orders. Some businesses are staying open despite orders to the contrary. And it certainly doesn't help the fact that many of our local politicians themselves have not always abided by these rules. So there's been an interesting piece in the LA Times in which a number of very prominent public health experts called for an alternative approach rather than the strict safer at home orders, and they're calling it a harm reduction approach. The idea comes from our experience with other public health crises like IV drug use, HIV, sexually transmitted infections. And what we've learned from these previous experiences is that the puritanical approaches, so for example, abstinence-only education, can actually backfire. And sometimes a more lenient risk reduction type approach is better in the long run. So condom distribution to limit STIs rather than abstinence-only, rather than a just say no approach to drugs, safe needle distribution so that at least people will do it safely and minimize the risk. So in this LA Times article, Emily Osler and a number of other prominent public health experts tried to apply this to our COVID-19 situation. Emily Osler said some of the things that they've been telling us to do, such as stay in our house all the time and close outdoor dining, are actually very, very safe. And it's just going to cause people to turn away and stop listening. So instead, what these experts are saying is that to acknowledge that people do want to and should be able to see in certain limited fashions family members and friends. But if we're going to do it, let's do it safely. So let's do it in small groups, outdoors, with masks, with social distancing. And that really should be the focus of the public health measures, and get everyone to say, this is how we're going to keep our hospital capacity safe until the vaccine is out there. So I think I tend to agree more with that less strict, less puritanical, more liberal approach. But it's obviously an area of controversy, and it'll be interesting how things shape up over the next couple months. So with that, let's jump into our interview today with Dr. Jessica Hochman. Well, here in the studio today, I would like to welcome the best pediatrician I know, Dr. Jessica Hochman. Welcome to the Healthy Skeptic MD.
Well, thank you very much, and thank you for inviting me. Somehow I had a connection to get invited on the show on the Healthy Skeptic MD, so I'm excited to be here.
Connection or not, it's great to have you, and we've talked a lot about adults and coronavirus, so we wanted to have a pediatrician, and we'll hopefully learn a lot today. So my wife, Jessica, has a pediatric practice in Oak Park, California. It's in Southern California, borders on Los Angeles. Can you tell us a little bit about the practice? What types of patients do you serve?
So I serve a wide variety of families and patients from different medical conditions. Mostly, I'd say healthy families, but a variety of ages, anywhere from birth all the way through college. I take care of kids. I've been in private practice now for almost 10 years, and I love what I do. I'm very proud of what I do, and I get a lot of job satisfaction from the great families that I take care of.
Well, in my biased opinion, she's a great pediatrician, so happy to have her today.
Just a little biased, right?
So we've talked a lot on the Healthy Skeptic, as I said, about what coronavirus looks like in adults. And we had Dr. Peter Cohen talk a little bit about the clinical manifestations and diagnosis for patients a couple episodes ago, but today we're going to focus on children. So could you begin by just talking a little bit about what coronavirus looks like in children? How does it commonly present? What are the common symptoms in kids?
Great question. I think I have the easiest job of probably all of your guests, because talking about children and coronavirus, I get to deliver a lot of good news. I think children and COVID have actually been the shining light of this pandemic, just because kids are doing so well. So the kids that have had coronavirus, the symptoms that you might expect range from either no symptoms. So a lot of kids have been found incidentally because one of their parents was sick or a teacher was sick, and so they were tested. I'd say that's actually majority of the time. Sometimes kids have fever. A lot of the times it looks like a cold. So fever, cold, sometimes a cough. But generally speaking, with children, the symptoms are quite mild, which is great.
So it's fair to say that generally speaking, and not that there's never a serious case, it's a less serious infection in children than in adults.
That's absolutely true. So if you look at hospitalized patients for coronavirus. So at any given time, who's in the hospital, so sick enough to be in the hospital, children only make up about 1 to 3% of the total hospitalized cases. So definitely we are lucky to see that kids are faring much better with COVID.
Okay. So there's been a lot of discussion in the media about this condition called multisystem inflammatory syndrome in children, MISC, I think it's called.
Yes,
it's a more serious. I'm an internist trying to talk like a pediatrician here. So it's gotten a lot of media attention. Could you just tell the listeners a little bit about how that presents and why it is such a serious concern?
Yes. Okay. So MISC is thankfully a very rare condition. We're seeing it in about every 2 in 100,000 kids. So it's quite rare, but it can be quite serious where kids have a range of symptoms of anywhere from abdominal pain, so their stomachs really hurt. They can have trouble breathing. They can be quite uncomfortable, high fevers. So I think the bottom line for parents really, because it is such a rare condition, is not to worry about it, not to panic about it, but just really to know what signs to look for should you suspect your kid is ill with this. Just make sure to bring it to your doctor's attention or take them to the emergency room, because the good news is that there is a cure for it. There is a treatment for it. So it's a treatment called IVIG. It works pretty well in most kids that have this condition. So I think don't worry about it, don't panic about it, but just know that there is this MISC out there, and should you suspect anything, make sure to contact your healthcare provider.
Okay, so one question.
Does that make sense?
Yes, that absolutely makes sense, and for what parents should look out for. One question that parents might ask is how common is this? It's rare, but what exactly does that mean? Do you have any numbers
for how common it is?
Yeah.
It's looking like the average age of the cases are around 8 years old. So the case age can range, but we're seeing it about 2 in every 100,000 children.
Okay, so pretty rare condition. And of those, I think there's been a little bit over 1,000 cases in the United States, according to the Centers for Disease Control statistics. Have any of these resulted in death, and how common is death?
So I don't know the exact number, but it's pretty uncommon. It's present, and I believe it's mostly in children of minority backgrounds. We're seeing it more in the Afro-Caribbean kids, Black, Latino populations.
So here in Los Angeles, we have 3 young children. Can you just remind me how old are our children?
I'll jog both of our memories. Okay, we have a 5-year-old who's in a girl who's pre-K age, a 7-year-old in 2nd grade, and a 4th grade daughter who is 10 years old.
All right, I have to remind myself from time to time. So our children have not been going in-person school. It's been all Zoom school for them. But there's been a mix. There's been some schools that have been open and some that haven't. First of all, what in your practice in Oak Park, what's the mix? Have you seen that a majority of the children are in-person versus virtual?
So it's actually pretty interesting. I get to see a mix of situations because my practice is actually just outside of Los Angeles. So we have a fair number of kids that are families that live in Los Angeles where public schools are closed or in-person learning is closed. It's all Zoom learning. And then there's a fair number of private schools as well as public schools that are just starting to open. And so I get to see a variety. I think a lot of families have different experiences and different concerns about going to school. But I think the vast majority of kids that are now in in-person learning, the parents are so happy. They're seeing their kids' behavior improve, their happiness improve. And so it is interesting to see that juxtaposition of different family situations.
Mm-hmm. So right now the coronavirus cases are surging. And so it may seem like a funny time to talk about reopening schools, although certainly some schools in many parts of the country have remained open.
Yes.
Let me just start with, at a basic level, if schools are to open, what are the simple things that can be done to minimize the risk?
Okay, so I think you're asking the question that's on everybody's mind. We're so desperate to get schools reopened, but at the same time, numbers are going up. So how do we reconcile that? But yes, I do think there are a lot of simple things we can do to ensure safety or minimize harm, and that would be to encourage mask wearing, keep kids at a distance, provide proper ventilation for rooms, and get the kids outside whenever possible. So I do think it is possible to reopen in a safe manner.
Yeah, and certainly other parts of the country where it's a lot colder, being outdoors during the school day may not be realistic. I mean, we're very lucky here in California,
Right.
and ironically, here in Los Angeles is one of the places that's been most conservative about keeping the schools closed. One thing, we
That's a
do
good
have
point. Yeah.
little kids. We know from personal experience, it's not easy to keep the masks on them. How important is that, and do you see that as feasible to keep the masks on children?
I do think it's feasible. I think kids are pretty compliant. I think at first, when we were encouraging mask wearing amongst kids, I wasn't as sure, but I really see kids following. In our office, we have a rule that kids do wear masks when they come in the office, and they comply. They're able to keep their masks on. So I definitely think, while it might not be perfect, especially with the younger kids, I think it is absolutely possible.
Yeah. So I'm embarrassed to say that our kids are not the easiest to keep the masks on, but I do think it's possible. And part of the reason I think that is we actually took a family trip to Japan before the pandemic. So this was even pre-pandemic. And many of the children in Japan were wearing masks. And certainly during this pandemic, in the places that have open schools in Asian countries, in many parts of the US, they have succeeded in getting masks on kids. I also think that our kids would probably do it more consistently if they saw their friends around them doing it.
But I think what's so interesting is when you look at schools that have remained open, it looks to be really safe for both the children and safe for teachers. I haven't read about a teacher that has gotten sick enough to pass away from a student. So while teachers have come down with the coronavirus and been sick from it, I have not yet read about a student that has passed it to a teacher where they have done poorly. So I might be missing something, but I think generally when teachers have been ill from COVID, it has not come from a student, it's come from another adult.
Yeah, so there's been an interesting observation that coronavirus certainly does spread from adults to children, but it seems, I think there was a pediatric study over the summer that showed that it's only very rare, maybe 10% of the time or less, that kids get it from adults. What do we know about the transmission between kids and adults versus into kids?
Yeah, so this is what I think is so fascinating about COVID, because this is totally different from other viruses in my experience as a pediatrician. For example, the typical flu or the typical cold, usually kids are petri dishes, or they're the ones that spread the virus and then pass it on to their grandparents, their adults, or those that are more vulnerable. But what we're seeing with COVID, which I think is really wonderful news, is that kids really aren't spreading it. It's possible. I mean, they do get coronavirus, they don't get as sick, and they do spread it, but at a much lower rate than adults. So there was a study in China that looked at where the virus is transmitted, and 96% of the time, when they contact traced the coronavirus, it was from adult to adult. So not from kid to adult or kid to kid, but passing from adult to adult. And the same in Geneva, they looked at about 40 families, and there was a small study. I think it was really interesting. They looked at 40 families and where the SARS-CoV-2 virus, how it was transmitted, and it was only, I think, 8% of the time was it from a child to an adult, and the rest of the time it was from an adult to adult. So, I mean, that's another reason why I do think we can open schools safely, because most of the passage of the virus is not happening from child to adult.
Right. So it does happen, of course, but it does seem that it's much less common anyway from adults to get sick from children. Of course, the people that we're really concerned about are certainly school staff and teachers who have high risk medical conditions. Certainly my concern as a primary care doctor is that would put them at risk. So we have to actually take the situation very seriously, do everything we can to prevent that from happening. But the good news is that the transmission seems to be low. That's actually a curious finding. Why would it be that kids wouldn't, like many other conditions, aren't passing it as readily to adults?
I'm so glad you asked, Dr. Hochman. There's a couple of proposed theories. Of course, we're going based on the science that we know now, so it might change over time. But one of the theories is that kids do not mount as much of an immune response when they contract the virus. So there's something called a cytokine storm, or there's a response that the immune system makes, which people can feel sick from, and kids do not mount that same response. So That's one theory why they don't get as sick. The other theory, and this was shown in Singapore when they looked at the cellular level of how the virus actually enters the body, there's a receptor. We've called it the ACE2 receptor, and this receptor is primarily in the lungs. And in children, so where this virus should enter at the receptor level, in children, there's either not that many of these receptors or they're underdeveloped. And so there's literally difficulty for the virus to enter and proliferate. And so that's also one theory why children are not getting as sick and why they're not spreading the disease as effectively. So,
yeah, it's very interesting because
too detailed, but
right.
Yeah.
In many other viruses, as you said, it's very common that opening schools has a big impact. And again, not to say that there wouldn't be an increase in cases as a result from opening schools, but maybe not as big. And if we could do everything we can to mitigate those risks. So
Right.
Given all this, it's obviously a very complex decision with value judgments involved. And I don't
Yes.
think anyone's suggesting tomorrow with the rates going up as high as they are, but maybe when the second semester starts, should we be pushing hard at a policy level to get kids back in school?
So in my personal opinion, looking at the scientific data that we know, and admittedly, we do have 3 elementary school kids, so it probably
A little bit of bias
factors into my my decision. But I do think we should open. I think for a multitude of reasons. I think one is we can get creative about how to open. Maybe start. I've seen some schools start kindergarten through second, and then increase the age as they deem safe. I think that when kids are at home, there's serious consequences. It's not just coronavirus, avoiding coronavirus that fares poorly for their health, but I'm seeing tons of kids suffer. I mean, really, even just this week, I've talked to families where their kids are having terrible emotional outbursts where it's leading to violence. Today, I talked to a child who's having an eating disorder. I talked to a family yesterday where their 9-year-old child has gained over 50 pounds since the start of coronavirus. A lot of depression, a lot of anxiety. And so I'm seeing kids really have a hard time. And I'm actually surprised, quite honestly, because kids are generally so resilient. But how much mental health I'm seeing, how many mental health issues I'm seeing from kids, before my eyes. And it breaks my heart because I'm seeing kids, I've never actually seen this before where I can't get kids into to see therapists for anxiety. They're so full, they're so booked. And I really do think a lot of this stems from their loneliness, from their isolations, from their feeling of isolations. And I think it's hard for kids to be at home. What do you think?
I think you even mentioned to me there have been a couple suicide attempts in your practice.
Yes. So in our practice, we've had 3 suicide attempts in the past few months. And that, it's hard because I really know these families well. And I'm certain that being home has played a role in their feelings. There's actually a study in June where they found that 1 in 4 teenagers have seriously contemplated suicide. Now, that number is hard for me to believe, to be honest, but that's what the study did show. Also, in the emergency room, there's been a decline in ER visits from kids overall for sickness. And I think that's just because we've been doing such a good job at being isolating from one another. So there's less overall sickness, but there was about a 30% increase in mental health visits to the ER comparing 2020 to 2019.
Well, it's really sad. And, like I've mentioned in previous episodes of the Healthy Skeptic MD, in my practice, I've also seen it in adults with increased anxiety, substance abuse, even domestic violence. And it sounds like it's spilling over, sadly, into kids as well.
Yes. One other point I wanted to make. I also really feel like the kids in lower socioeconomic status families are really suffering. There's a lot of families that are, single parents or the parents are out of work. And the LA Unified School District didn't exactly tell us the numbers, but there's been a record high in attendance of school, and as well as D's and F's. And I know in Carlsbad, for example, the D's and F's have doubled. So in Orange County, they're seeing more D's and F's as well. So I think, education to me is so important for kids, especially kids that are in those poor neighborhoods. It's their, gives them purpose. It gives them value to get educated, and they're really missing out. And I worry what this means for their future.
Yeah, actually, there was a JAMA study that you and I spoke about a couple of weeks ago that came out. And again, these are
That's what we
modeling.
talk about at home.
Pretty exciting. I'm
Exciting.
sure everyone wants to join the Hochman household.
Right.
And it was a modeling study, so it's not hard science, but it's an estimate of the overall impact of keeping schools closed on children's life expectancy, because it acknowledged that there are some downsides in terms of lower educational attainment, having negative impact on the health outcomes of children. What did that study conclude?
So that study showed 5.5 million lost life years from children because of the closure of schools, which is a hard number to believe, but there are serious, what they're finding is there's definite health implications negatively to not going to school.
Right. So undeniably, there probably would be an increase in spread of the virus as a result of reopening schools, and there probably would be some viral-related deaths, but we would also spare, according to this JAMA study anyway, some unintended consequences that could have very bad health outcomes. And the study concluded the net effect of keeping schools closed was unfavorable.
So now, just to challenge you a little bit, I'm not certain on this, but I actually don't know that we would see an increase in COVID cases if schools were open. I'm not actually sure about that, because when kids aren't in school, a lot of times they're home, intergenerationally with a grandparent, with an older caretaker. And because we are seeing that spread a lot from the older generation to the younger, I'm not actually sure that we would see such a increase in cases if kids were to go back to school. What do you think?
Well, you were challenging me, but I'm going to agree with you. And we've certainly seen families in our neighborhood where grandparents are needing to step in more during the daytime to help kids with the Zoom school while the parents are at work, which is not what's supposed to be happening. It's sort of an unintended consequence.
Right. Or kids that are out of work, or younger adults that are out of work that are now living at home with their families, their grandparents. So while you may be right, we might see an increase in case number. I also think just because kids are so ineffective at spreading coronavirus, I don't actually know that that's for sure going to be the case. I'm optimistic.
Well, to conclude, and again, we acknowledge our bias. We've had a number of discussions about this. I think we both feel that we should certainly be pushing harder to get schools reopened, and by taking it seriously, there's ways to do it safely, and the net impact of that on society could probably be good. And we certainly have examples from other parts of the country and the world where it's gone okay, reopening schools.
And I also want to comment, a lot of people will say to me, but what about the teachers and their safety? And what about the families where they have kids with somebody in their home where they could, gravely be impacted by COVID? And I just want to say, I do firmly believe that there should be options for teachers that are in those higher risk categories, the older teachers, the immunocompromised, those that don't feel safe going back to school. I think there should be an option for them to teach online. And I do also think for those families that are worried, they could also, have continued Zoom schooling. But I do think for a lot of families, it'd be great if they could have the option to send their kids back to school, because I do think we can do it safely. And I do think it's better for their ultimate health and education.
And one other thing I'll acknowledge on the counterpoint side
when you counterpoint.
Before we move on, there was a surge in Israel, for example, after the schools reopened. And there was also over the summer a report from the CDC in Georgia about camps reopening and a number of outbreaks occurring. Now, in many of those situations, kids were not using masks and they weren't taking the simple measures. But nevertheless, it does show that there is a potential for a surge in cases when schools open.
Yes. Okay, so I totally agree with you. I think there's a potential for outbreaks, especially, like that school in Israel. I don't think they were abiding by social distancing particularly well. But I also want to draw a distinction. Personally, I think there's so much focus and emphasis on case number. But to me, I think what's I don't want to say more important indicator, but something worth considering strongly is not just the case number, but the actual death number, and who's getting sick from this, who's in the hospital from this, who's in the ICU. And what's so interesting with kids is while we've seen a large number of kids get COVID, just such a small number actually have poor outcomes. So For example, in California, we have the highest number of kids with COVID. Almost 140,000 kids have COVID. That's higher than any other state. But we've only had 2 kids. I don't want to say only, because every my heart goes out to any family that's suffered from COVID outcomes. But there's been 2 kids that have passed away from coronavirus in California, and both of those kids had grave medical conditions, pre-existing conditions. So while I just want to comment, while we hear about a lot of schools that may have outbreaks, my follow-up question is who's getting sick from that, from those cases, because so many kids are so mild, so many cases are asymptomatic. So that's the question that I always ask after I hear about the case number. What do you think?
Well, I agree. And actually, our school superintendent in the local LA Unified School District, Austin Butner, was quoted the other day in the paper as saying, if we can get malls open, there sure seems that we should find a way to be able to get schools open. So I think if we take it seriously, we respect the virus, we do the simple things that work, I personally think the net effect of getting schools open would outweigh the downsides and the risks.
So it sounds like we both agree, take the virus seriously, implement safety precautions, and give it a try. And we can always close, right? I mean, schools can always...
Right. You can give it a try.
Give it a try, yeah.
So I'm...
Glad we agree.
So am I. Yeah. So I'm hopeful that maybe in January, when the holidays end, that might be a good time, especially with the vaccine on the horizon. And that actually is a good segue into the next topic, which of course we have 2 very exciting vaccines, possibly others, the Moderna and the Pfizer vaccine, that are being considered for approval, and AstraZeneca, right, although that one's maybe a little further behind. And it's very likely that there's going to be an emergency use authorization for healthcare workers and high-risk nursing home residents coming in the next couple weeks. But already we're getting questions about kids. Should kids get the vaccine? Has the vaccine been tested in kids? So maybe we'll start there. What studies have been done so far of the Pfizer and the Moderna vaccine in kids?
Okay, so first I want to say I think it's incredible that we have these vaccines on the horizon. They look incredibly effective, more effective than the typical annual flu vaccine. So it's all very exciting.
And I think you and I, in fairness, were skeptical that the vaccine was going to be this effective. It certainly has exceeded my expectations.
Yeah, because I live with a healthy skeptic over here. The flu vaccine, so typically respiratory viruses are hard to make vaccines for because they mutate so quickly. So for example, the flu virus, the cold viruses that exist, it's hard to vaccinate or come up with a good vaccine. I think the flu vaccines are a worse vaccine in terms of protective ability, about 50% protectiveness every year from the flu shot. But looking at 95% effectiveness from the initial vaccines, I think is excellent. So first, I'm very excited about the prospect of the vaccine. I hope, I can't wait to hear, I'm very optimistic how it does for the world. But in terms of children, it has not yet been adequately studied. The Pfizer vaccine, I believe, has only looked at about 100 kids age 12 and older. With children, when you talk about an already very healthy population, a population that's doing so well as it is with COVID, I want to see 2 things. One, that it is safe. So number one, it has to be safe, has to go through the proper safety channels. And then I want to see that it's effective. So I agree that the vaccine should be initiated with healthcare workers first, as well as the vulnerable, the elderly. Those are the most important tiers. But then kids, I'm optimistic that that it will be effective and safe, but I think it's going to take some time. What do you think?
And I think the risk benefit thing is very important. So you said earlier that 2 out of 100,000 children are at risk for that multi-system inflammatory syndrome, which is a life-threatening condition.
Yes.
This vaccine's only been tested in 40,000 adults.
Right.
So not 100,000.
Right. So
for us to feel confident that we're going to do more benefit to kids, that we're going to prevent 2 out of 100,000 cases of this multi-system inflammatory syndrome, you'd have to do that, have a lot of kids vaccinated to prove that there's no safety concerns that occur more rarely than that. And kids' immune systems are funny, and sometimes you do get unusual reactions to it. So,
right.
So while I'm ready to endorse it for adults, I agree with your caution in children so far.
Right. I think, a lot of the public health discussion about the flu vaccine in kids is that even though kids fare well with the flu typically, the argument is to protect the children so that they protect the elderly, because typically kids are the vectors for the for the influenza. And so it's to protect, the elderly, those in nursing homes, the grandparents. But in this case, because we're not seeing COVID spread so efficiently from kids to adults, I agree. I think, I first want to make sure that it's safe for our kids, absolutely, before it's recommended. What do you think? When will we give it to our kids?
Well, you are asking me the question I was going to ask you next. What would it take? How many kids would you need to see get it in a study setting for you to feel comfortable recommending it for your patients and, of course, for our 3 kids?
So I think, definitely I want to give it to my parents. My father's a healthcare worker. He's absolutely someone I want to give it to. I think the benefit outweighs the risk. Myself, I would like to get it. I think I'm at moderate risk. I'm 40 years old. I'm a healthcare worker.
And you have the exposures at work.
And I have the exposure. And then my kids, I think, I don't want to see any shortcuts. It should be, I don't know the exact number, but it should be similar to other vaccines that the FDA has cleared as safe.
Yeah, I agree with that. And I think, the Moderna study was about 40,000 individuals. I actually think we would want to see a study comparable size or pretty close before we start giving it out in kids. I know some might disagree and want to push for it sooner, but before I'd feel comfortable giving it to my kids, I think that's what I would want to see.
From a true healthy skeptic.
But not everyone may agree with me, as others might be a little more liberal on that. Okay. My final question for you, Dr. Hochman, is you're a pediatrician. A lot of parents call you with concerns and worries. What general advice would you give to parents who are worried about their kids right now with coronavirus?
So I think it'd be impossible not to worry if you heard your kid had coronavirus, just because the level of anxiety about this has been so high. But I would just reassure them that, I think the numbers are really important to think about. One is that, kids have done better in terms of mortality or death rate than the typical yearly flu. So I don't hear many parents worried, or so anxious when their kids are diagnosed with the flu. And kids are actually faring even better than that with coronavirus, which is hard to believe, but it is what the numbers are showing. So I would, reassure them. I would tell them, I will check in on you, which if you're my patient, that's typically, I try at least. I will, if you need it, I will
vouch for that happens.
I will check in on you. I will tell you what to look for, when to go to the emergency room. So if there's difficulty breathing, looking blue in the face, high fevers, not urinating, not eating, all these are valid concerns. But typically kids are doing very, very well. Your best friends are rest, Tylenol, and staying hydrated and continuing to eat. But just know that if your kid or any child in your life that does get the coronavirus, the odds are so in their favor that they will do well. Just make sure to stay home so we don't, we keep it in your home and not spread anywhere else, right?
Well, I think that's great words to end on. And I'll just say, distilling.
How was that advice? Was it okay? Anything you'd add?
I think it was great. And I would say overall, my take-home lessons from this interview and living with you for the last 9 months is this is certainly a virus that should be respected in kids. We should take the situation seriously, but we should not panic. The vast majority of children do very, very well with this. And as long as we monitor things closely and you have an action plan, if there's a problem, you know who to call, you have a pediatrician, there are treatments, and most kids do really well, and panicking is really not necessary.
Very well put, and I agree wholeheartedly with you.
Well, thank you so much for tuning in.
Don't panic.
Good word to end with. Well, thank you so much for joining me again today to listen to the Healthy Skeptic MD podcast. Hope you liked what you heard. If you find it interesting, please share it with your friends. Sign up, subscribe, and we will look forward to seeing you next week again on the Healthy Skeptic MD. Thanks for joining.
Thanks for having me. I hope I get invited back.